In this video clip, we will talk about why this is so important to reinsert the wax bite taken for the twin block. If you are a beginner and doing your initial cases of the twin block, then I will highly recommend you to reinsert the wax bite in the mouth so that you can cross-check and verify everything. Everything means you could be able to cross-check the face as well as the dentition. So what are the steps involved? You will take the initial bite. Once taken out of the mouth, then you will trim the bite almost in the middle of the occlusal surface of the teeth, so that when you will reinsert, you could be able to see the buccal surface without the overlapping of the wax on it. So when you will trim the bite in this way, as you see in the photograph, almost half of the occlusal surface will be available, and you could be able to see the dental midlines as well. First, after removing from the mouth, place it in the cast and see the midlines and the transverse relationship. Then you will reinsert in the mouth and you will see the face as well as the dentition. Face you will see in the 3 plane of spaces, and dentition you will see in the 3 plane of spaces as well. In the face, you will see how much you have advanced in the anteroposterior plane, what is the transverse relationship, especially of the chin, is the advancement of the mandible is causing the midline deviation or not, especially the chin. And you will see how much you have raised the vertical. For example, I say in the start that how you will identify a suitable patient for the twin block, that on the advancement of the mandible, the face is not looking too much elongated and the lower facial height is not too much increasing. As you know, one of the contraindication or relative contraindication of the twin block is hyperdivergent or a long face, because how the face will look like after the growth modification or twin block treatment is how it will be after wearing the twin block. Okay, so how much the twin block will be advanced, vertically open, or maintain the face in the transverse plane is completely dependent upon the wax bite registration. So when you will reinsert the bite in the mouth, ask the patient to close and examine the face in the 3 plane of spaces. You will see how much is the advancement. For example, you need to verify that this level of advancement is causing too much discomfort to the patient. Then you can rethink of lesser advancement. If you think you have advanced like 8 or 9 millimeter forward, then you can go for the gradual advancement and you can retake the bite. You will cross check. That is the most important thing, is to see the symmetry of the face. If the chin is deviating on the one side or not, or the other side, the chin has to be completely symmetrical, and you will carefully examine from the 12 o'clock position that on the advancement of the mandible, the face is purely symmetrical. Then you will see the vertical facial proportion, that if this advancement bite is causing too much increase in the vertical or not. If you think that this advancement is increasing the vertical too much, then you can decrease the thickness of the bite and you can reconsider your decision of twin block treatment, and then you can reconsider the decision of twin block patient or growth modification treatment in that particular patient. Coming to the dentition part, as I said, you will see and examine the dentition as well in the 3 plane of spaces. You will see the midlines, if the upper midline with the maxilla and the lower midline with the mandible is on. Please listen this carefully. If the upper midline is maxilla is on, if the lower midline is mandible with the on, then on the symmetrical advancement, the dental midline must be on. But in some rare situation, if you have a missing lateral incisor, or if you have a hyperdontia of the lower central incisors, then definitely you would not be so much careful about the midlines, and you understand that the midline matching cannot be your objective on the advancement of the mandible. So if the upper midline is on with the upper jaw, lower midline is on with the lower jaw, then on the advancement, the dental midline should be on. In the transverse plane, the second most important thing is how much is the transverse relationship of the posterior teeth on the advancement of the mandible. This will guide you, do you really need an expansion device in the upper jaw or not, because this is a relative transverse maxillary deficiency that will appear on the advancement of the mandible. So you will also see that the mandible has symmetrically advanced and you're not having a kind of Rudy's bite or any kind of cross bite on the advancement of the mandible, unilateral cross bite I mean to say. So you have to have a symmetrical situation in the posterior part as well. This is on the reinserting, you have a chance to examine what is the incisal distance in the vertical plane, because whatsoever situation you see at the moment at the advancement of the mandible, this would be exactly the situation after the insertion of the twin block. So you will verify the interpremolar distance, intermolar distance, interincisal distance as well in the vertical plane. And sagittal plane, you see how much you have advanced. You will see the molar and canine relationship. You see this may be coming in the class 3 relationship, because I remember my days of residency, I was worried that after twin block it will become class 3. No, even if it's becoming class 3 canine relationship or molar relationship, forget about it, ignore this dental relationship, focus on the face, and whatsoever is the molar or canine relationship, ignore at the moment and see how much the face is improving on the advancement of the mandible. For the reinsertion, the most important point is which type of wax you are going to use, because the modeling wax that are typically used and very commonly used is not recommended for the reinsertion point of view, because there's a lot of difference in the physical properties of the modeling wax and the recommended wax for the wax bite registration, that is the alumina wax. The alumina wax, once becoming cold, become a rock solid, and you will not be worried about reinserting the alumina wax in the mouth again. The indentation that you have previously taken on the first bite registration will not be disturbed in the alumina wax, because this wax bite is very brittle and this may break but cannot be distorted, just like the modeling wax. If you put the modeling wax again, you would have the issue of the whatsoever the indentation of the dentition you have taken in the first attempt. This can be distorted and can be damaged if the patient is not exactly biting on the same place. But that problem is not with the alumina wax because of its physical properties. They become rock solid, they become very brittle. This may break, but the indentation will not get distorted if you reinsert the bite and recheck this. So make sure if you reinsert, you are using alumina wax, not the modeling wax. Thank you.